Hello, everyone, and welcome to Medical Sauce, where we make medicine simple, memorable, and fun. I'm Azula, your host for today's episode.
Yeah.
Today's topic is one every theater nurse, surgeon, and medical student must understand: clean, contaminated, contaminated, and dirty wounds. These 4 wound classes determine the risk of surgical site infection and help guide antibiotic use. Joining me is Dr. Momo. Welcome, doctor.
Thank you, Azula. It's great to be here. Many students memorize these terms without truly understanding them. Today, we'll make them simple.
Let's begin with the first category. What is a clean wound?
A clean wound is exactly what the name suggests. It is a surgical wound where there is no infection, no inflammation, the respiratory, gastrointestinal, genital, or urinary tracts are not entered. Everything is done under sterile conditions. Examples include hernia repair, thyroid surgery, breast surgery, joint replacement.
So nothing contaminated is open during the operation.
Exactly. Think. Clean means completely sterile.
What about a clean contaminated wound?
This is still a controlled operation. However, the surgeon intentionally enters a body tract that naturally contains bacteria, such as respiratory tract, gastrointestinal tract, urinary tract, female genital tract. Importantly, there is no unusual spillage and no active infection. Examples include cholecystectomy, elective bowel surgery, hysterectomy.
So bacteria may be present naturally, but everything remains controlled.
Exactly.
Now let's move to contaminated wounds.
A contaminated wound occurs when sterility has been compromised. This may happen because of major spillage from the bowel, fresh traumatic wounds, major break in sterile technique, and acute inflammation without pus. Examples include fresh open fractures, penetrating abdominal injuries, and large bowel spillage during surgery.
Wow, those are critical examples. So contamination has already occurred, even though infection may not yet be established.
Precisely. And that's the key distinction, you see?
I do. It makes perfect sense. Finally, what is a dirty wound?
A dirty wound is one that already has an established infection before surgery begins. Examples include pus inside the wound, perforated bowel with fecal contamination, abscess drainage, old traumatic wounds with dead tissue. In other words, the bacteria have already multiplied and caused infection. Yeah.
So the operation isn't preventing contamination, it's treating an infection that's already there.
Exactly.
Dr. Momo, can you compare all 4 in one simple summary?
Of course. Clean, no infection, no body tract entered. Clean, contaminated, body tract entered under controlled conditions, no unusual contamination. Contaminated, sterility is broken or fresh contamination occurs. Dirty, infection already exists before surgery. Sure.
Before we end, give us a memory trick.
Remember the progression. Clean equals no bacteria introduced. Clean contaminated equals controlled bacteria exposure. Contaminated equals accidental contamination. Dirty equals infection already present.
That's an excellent way to remember it. Thank you for listening to Medical Sauce. Share it with your classmates, colleagues, and friends. Don't forget to subscribe. Please answer the following question, and we will give you a shout out in the next episode. Today's shout out goes to James Marte Antonio. Congratulations.
Yes, congratulations.